Okay, we want to welcome Dr. Yossi Unterslak, specialist gynecologist specializing in infertility with a real interest in helping women prevent recurrent miscarriages. We are very excited to have you on one of our game podcasts. Welcome, Yossi.
Thank you. Thanks for the invitation, and I hope I can shed some light.
I have no doubt. Yossi, perhaps just to start, a lot of our moms have, pregnant moms, I guess, or moms wanting to become pregnant, have real concerns and worries at this time. It's a very anxious time, I think, for pregnant moms. What would you want them to know? What information do you think it's really important that pregnant moms have at this time about what it means to be pregnant during COVID-19?
Okay, so I think there's a couple of things to say. The one thing is that this is it's a novel virus, it's a new virus, and we're learning new things every single day. And so what we say today, we say with caution, because we do know that this is very early in the pandemic, and things do change on a daily basis. But what we do know at the moment is that moms that are pregnant that are currently pregnant are at no increased risk of developing COVID-19 or the disease associated with coronavirus. Also is that moms that do contract coronavirus are at no greater risk of developing severe disease. And we don't believe that the virus crosses the placenta and affects the baby. And we don't believe that it's got any negative effects on a pregnant woman. One thing we do know is that moms who contract coronavirus and do get the disease in quite a severe form late on in the pregnancy can go into preterm labor. And that really seems to be the only real risk at the moment with pregnancy and COVID-19. The WHO, the World Health Organization, which is where we obviously take a lot of our guidance from, have not issued a global warning on falling pregnant at the moment. And this is because we don't feel that pregnancy is contraindicated at this time. And so until such time, we feel that it is safe for people to try and fall pregnant and safe to be pregnant. There's obviously lots of emotional stuff, which we'll get into, but certainly from a medical point of view, it's safe to try and fall pregnant, it's safe to be pregnant, and we don't believe that being pregnant puts you at high risk of contracting or getting severe COVID-19.
And tell me, given what you've said about kind of the potential of premature labor, are there any precautions you think that pregnant women in their kind of third trimester should be taking?
Absolutely. So obviously all the recommendations that we've all heard a million times: wearing masks, social distancing, hand washing. But I think that pregnant people really have to take this more seriously than the average population, especially women in their third trimester, for a number of reasons. Because we don't want them to go into preterm labor, and we don't want them to put a burden on the neonatal ICUs and admissions, etc. But also because a woman who goes into labor with coronavirus or COVID-19 has to be managed in a very specific way, has to be managed in an isolation ward, has to be managed by doctors who are wearing full PPE, won't be able to be with her baby, her husband won't be able to be present at the birth. So they really have to be very, very careful so that they don't contract the virus. So I think it's the time to use e-commerce and do your shopping online and not go out to the shops, and really to take the regulations seriously.
Right. And tell me, given your specialty, what I'm particularly interested in hearing is, what advice would you give to couples that are or have been considering doing IVF? They want to look at kind of starting that kind of process. What would you say to those couples at this time? What advice are you giving?
Okay, so Nicole, we had an episode when things really started out in South Africa, when the country went into lockdown, and the South African Society of Reproductive Gynecology put out a statement that said we should halt all fertility treatment until we see where things were going. And it was an incredibly traumatic time for our couples who were going through treatment. We were allowed to complete those that were in cycle, but those that were planning to start cycles, we had to postpone their cycles. And for couples that have waited months to start the IVF program and saved up money and emotionally have prepared themselves to suddenly have this, this extra trauma was really heartbreaking for them. And so we've seen that. And I think the reason that the government and the South African Society made these regulations was we just weren't sure where things were going to go, how quickly the virus was going to spread, and primarily how urgent we were going to need hospital beds and doctors. And so they wanted us all to be ready and waiting. But I think as time went on, we realized what huge ramifications this was having on couples that were about to start their IVF. And when we reopened our doors on the 1st of May, you cannot believe the relief that there was, that the patients came flooding back, desperate to get started. And so we're being very careful. We are actively testing all of our patients who are undergoing IVF. So not just screening, but testing them for coronavirus. We're testing our staff, and we're being very, very careful in the practice to limit the numbers that are coming through the practice, so that should there be someone who happens to be infected in the building, there's no spread. But other than that, we are going about business as usual, and trying to, get as many patients onto programs so that they can continue with what they've been waiting so long for. So our guidance at the moment is to carry on with treatment, taking the necessary precautions. We don't know how long this is going to be around. And this, if we told people to wait, it could be 2 months, it could be 4 months, it could be 6 months. And that really is significant, especially in our group of patients who often have a poor prognosis, and time is critical in these patients. And the longer we wait, the poorer their prognosis becomes. So there are certain patients who can wait. And, obviously we treat each case as it comes. But most of the patients we are going ahead treating with lots and lots of precautions.
Right. Because I guess what you're saying is it's so important, for these families that they have an opportunity, the possibility of having a child, that in fact you're taking all the precautions, but you're saying there's no reason that shouldn't go ahead.
Absolutely. I mean, the reality is for some of these couples, waiting a few months can be the difference between having a baby with their own eggs or sperm, or having to use a donor eggs or sperm. And that's got huge implications. So yeah, we're telling them to go ahead. We are continuing to treat them as aggressively as we would have, but obviously just lots and lots of extra precautions to make sure that there's no spread in the clinic, because if there is, then unfortunately we have to close our doors again, and that will be catastrophic to a lot of our patients. But also because we don't want patients who've just undergone a really intense treatment program to then develop symptoms, become ill, and potentially interfere with their chance of a pregnancy. So we're really making sure that we're protecting the patients as much as possible.
Right. But really what I'm hearing you saying is that this is a vulnerable time for everyone, but there is no reason why pregnancy shouldn't go ahead, natural or otherwise. It's just that the right precautions have to be taken all around.
Exactly, 100%. Yeah, I mean, we all need to be careful, but this is a group of patients, this is a group of the population. We have to really be extra careful. And we said it in a meeting the other day. We were talking about how often we have to test our patients, and we turned around to each other and we said, these are people who are so desperate to get going with their treatment. They're being so careful. We don't have to test them every single week, because we know they're going to the clinic and they're going home. They're coming to the clinic and they're going home. And they're really just being as cautious as possible.
Okay. Yossi, thank you so much. I think that will be invaluable for all mothers out there. So thank you so much for giving us your time.
Absolute pleasure.